History of the patient reception, patient history of the discomfort, irritation, itchiness, and the renal area and the skin. There is swelling, inflammatory process, and there is also blood stained stool, which is confirmed by the bright red stains over the toilet papers. Examination of the piles is done by digital rectal examination. In this process, we introduce our gloved, lubricated finger through the anus into the lower part of the rectum to estimate the location and size of the pile mass, or if there is other pathology like inflammatory lesion or polyps, that can be examined by the or by that can be judged by the digital examination. Also, the size of the prostate, that is a very diagnostic process through which by we can also estimate the size of the prostate, especially in the prostatic carcinoma. Differential diagnosis, because we have to exclude the other causes of bleeding, rectal bleeding, and the mucus discharge from the rectum. So there are other pathologies like colorectal carcinoma, ulcerative colitis, chronic inflammatory bowel diseases. So we have to differentiate between these pathologies. Now the treatment, medical treatment of the hemorrhoids or piles. As I have already discussed in my previous video, that the grade first and second piles, they doesn't produce any symptom in the patient, especially in internal hemorrhoids. The treatment is to alleviate the pain sensation by the analgesics like acetaminophen, ibuprofen, NSAID medicines. Then local or topical applications are available or manufactured by the additions of hydrocortisone, zinc oxide, petroleum jellies, and xylocaine chemicals. So they are applied to the mass of the piles. So that reduces the discomfort, irritation, itchiness, and pain, and relieve the patient. In addition to topical therapy, systemic, that is oral and intramuscular or intravenous steroid and the painkiller medicine can be given to the patient. Moreover, domestic tips, you can apply ice cold compresses to the piles. They also bring relief to the patient. Sitz bath, that is in water container which is consisting of lukewarm water, and you sit in that water container for at least 20 minutes twice or thrice daily. They also produces good results. When the internal bleeding, that is rectal bleeding and mucus discharge is excessive, then we can also use medicine Oral or intramuscular vitamin K therapy, transamin capsule or injections can be given intravenously, and Deflon tablets, they are used by the medical practitioners for at least 3 or 4 weeks. That can also reduces the discomfort and the extension and the progression of the hemorrhoids.